This is a basal insulin.
Mm-hmm.
How often do people have to take it? Is it a once a day, truly 24-hour insulin? Although I don't think there is such a thing as you can take it at 12 and then you don't have to take it for exactly 12 hours and you get an even baseline with no peaks or valleys. So where is this going to be as far as the time efficacy?
Yeah, so in answer to your question, we obviously use so-called pharmacokinetic and pharmacodynamic assessments. We believe that this is a basal insulin with a very flat or consistent profile, both from day to day, but also from person to person. Its long half-life does support once daily injection, which is how it's being assessed. Part of the phase 3 program is actually assessing the capacity to vary the time of administration over the course of the day. So we believe, at least to date, that the early phase studies support that this is a flat, consistent profile that allows once daily dosing and stable insulin effect over 24 or more hours.
So if a person was to take this at 8 in the morning, technically they would take it at 8 the next morning, but what happens if they take it at 6 o'clock in the morning or 10 o'clock in the morning? Are we going to see variances from what you've seen?
So one of the studies that I referred to will assess just that, which is variation in dose timing. So at this point, we have only the pharmacokinetic and pharmacodynamic data that I described, which support that some flexibility may be feasible, but the phase 3 program needs to be completed before I can answer your question in detail.
And what you had mentioned less weight gain.
Mm-hmm.
What kind of numbers have we seen? Is it weight stable? When you're comparing it, I presume you're comparing it to the basal insulins that are out there so far. If you compare the weight difference, what have you seen?
So again, two parts to answer that question. The phase 2 studies, which are obviously short-term studies, suggested that in patients previously treated with a basal insulin, in this case they were converted to insulin glargine, that when the conversion was made, there was actually weight loss reported in that phase 2 study. The full details of the phase 3 program won't be reported in detail, but the top line data suggests that in insulin naive patients or those converting from other basal insulins, at least less weight gain is what we've reported to date. And obviously the detailed results will be forthcoming after scientific and peer review and presentation at scientific meetings.